I am Chrissy. I will be your nurse practitioner student today. And can you tell me your name and your birthday?
Ashley Krautheim, 7/31/88.
Okay, and Ashley, what are you here for today?
I'm not feeling well. I have a cold, I got a cough, sore throat, runny nose, stuffy nose.
All right, so we'll start out just by reviewing some history here that I already have in the computer. Are you feeling healthy overall other than today, the sickness that you have?
Yes.
Okay. Any changes with your medical history? I have down glaucoma, migraines, irregular menstrual cycles, and acid reflux. Is that correct?
Correct.
Any new surgery since I saw you last?
No.
Still working at the hospital?
Correct.
Are you working from home or are you in the hospital?
In the hospital.
In the hospital. Still living at home with mom, second floor. Do you drink?
No.
No drinking. What about caffeine?
Yes.
Okay, and are you, how much caffeine, I'm sorry, do you have a day?
Like 1 cup.
Okay. Do you smoke?
No.
Vape?
No.
Any drug use at all?
No.
Okay. Any recent travel?
No.
Long car rides, plane rides, nothing like that?
Nope.
Okay. Do you work out, exercise at all?
Not really.
Not really. And medications, it looks like I have Protonix, you're still taking that?
Yes.
Zyrtec?
Yes.
Your birth control?
Yes.
A multivitamin?
Yes.
And Pepsid?
Yep.
Any new allergies that I should list?
No.
And up to date on your immunizations?
Yes.
Okay. All right, so you tell me that you have fever, chills, any of that?
No.
No fever or chills, I'm sorry. Any weight loss or gain?
No.
And any excessive sleeping? You're a little more fatigued?
Very tired.
You're very tired, okay. How long have your symptoms been going on?
About a week.
A week. Any, anyone else sick around you? Anyone at home?
No.
No, okay. And you haven't been in contact with anyone with COVID or influenza that you're aware of?
No.
No RSV either?
No.
Okay. You said you are complaining of a sore throat?
Yes.
Any trouble swallowing?
A little bit.
A little bit, okay. Are you keeping liquids down?
Yeah.
And food?
Yeah.
Is your appetite okay?
Yeah.
Okay. How's your breathing been?
I mean, I definitely have some congestion, stuffy nose, but for the most part, I feel like I can breathe pretty well.
Okay.
Seems to be getting worse though, not
Okay.
better.
No history of asthma?
No.
Are you coughing anything up?
Yeah, mucus.
Okay, what color is it?
Green.
Green, okay. You said you also have a runny nose?
Yeah.
What color is that?
Green, round.
Okay. Headaches?
No.
Ear pain?
A little bit.
Eye pain? Discharge?
No discharge, no pain.
No discharge from your ears either?
Not that I can,
Okay.
I'm aware of.
Okay. All right. Let me just make sure I didn't miss anything on our review of symptoms. Any itching?
No.
Do you feel congested? Is that what you said?
Yeah.
Okay. Any nausea, vomiting, diarrhea, constipation?
Nope.
Do you feel like your heart's racing at all?
No.
Okay. Do you have any swelling anywhere?
No.
Any chest pain?
No.
Urinating okay?
Yep.
Still no burning with urination?
No.
Okay. Any trouble with your blood sugar?
Nope.
Dry skin?
Nope.
And any dizziness?
No.
Shaking? Trouble sleeping?
No.
Any changes in your mood? Increase in depression or anxiety?
Nope.
Okay. You feel safe at home?
Yep.
Okay. All right. Mind if I take a look?
Sure.
And listen. Okay, looking at you, you have even respiratory rate. It's times a minute. I don't see any labored breathing. I can't hear any wheezing just from sitting across from you or having conversation with you. You have equal chest rise and fall. I'm just gonna have you take a big breath for me. Good. And look up. No trachea deviation. Okay, I'll take a listen if that's okay with you. I'm gonna listen apical. Pulmonic. Herbs point. Tricuspid. And mitral. I'm gonna go under, sorry. Good. Heart sounds are normal. I hear S1 and S2. No rubs, murmurs, or gallops. And then we're just going to take a listen to your lungs here. So I'll have you take deep breaths in and out. There's some slight wheezing over the left posterior lung. A little diminished anteriorly. You seem to be clearing pretty well your congestion because I don't hear anything sitting in there, so you have a good cough. No crackles, stridor. Otherwise sounds pretty normal. We'll get an x-ray though just to make sure that there's nothing in there that we need to treat, like a pneumonia. Okay. Looking at your eyelids. Eyelids are normal. I don't see any discharge, swelling, redness. Close them for me. Good. Open them. No redness at all. Okay. Conjunctiva are also normal. Maybe a little extra tearing, but overall pretty good. And ears. Take a listen here. You said you had a little bit of pain on both sides. Okay. Externally, I don't see any swelling. Ears are symmetrical. No redness, no lesions. Right ear. Canal looks good, clear. No lesion, no masses, no drainage. A little bit deeper. Okay, I see a little bit of fluid at your tympanic membrane and maybe a little bit of redness. No drainage, there's no cerumen impaction. Same thing. The external canal looks good. There's a little bit of cerumen right here in the top portion. A little bit more cerumen on this one, but and still the same thing. No perforation, no large amount of drainage, just a little bit of that fluid collection and redness. Okay. If only my otoscope would stay on here. Okay. Look at your nose here too. Nose is symmetrical. There's no deviated septum. No bruising, no redness. Maybe a little bit of redness just at the bottom of the nares there. You've been blowing your nose a lot.
Yep.
Wiping it a lot. Okay. Any difficulty with smell?
Yeah.
Yeah. I'm gonna have you just plug your left nair. Try to smell that. Smell anything?
Nope.
Nope. Try the other side. Smell anything?
Nope.
Nope. So a little stuffed up on that nose there. And then have you tilt your head back, look inside. Little redness. Maybe a little inflammation inside. Overall looks okay, but definitely probably got something going on here. Okay. And then your throat. Sorry. Go ahead and say ah for me. Stick out your tongue real good. Okay. Little redness on the throat. No exudate. Uvula is midline. And tonsils are normal size. I'm going to just palpate over your face here. Any pain up here?
Yep.
Pain.
Yep.
Pain there too as well.
Yep.
Okay. No mass is appreciated, but the patient does admit to pain. And then I'm just going to feel your lymph nodes back here. Preauricular pain here?
Yep.
Okay. No swelling. Pain here?
Yep.
Pain back in here?
Mm.
Pain all over, huh? Pain?
Nope.
Okay. Pain here?
Yep.
Okay. There's bilateral submandibular and submental swelling, and the patient does endorse pain there as well. Okay. So just reviewing everything, you have a sore throat, runny nose, pain over the frontal sinuses, as well as your lymph nodes a little bit swollen, some excessive drainage. When I looked in your nares, I only saw clear drainage, but you report that you have green or yellow discharge. I do hear a little bit of wheezing on that left side of your chest, so we'll take an x-ray for that. You didn't report any fever, chills, but just to be safe, we'll go ahead and get some blood work. We'll get a CBC and a CMP, a magnesium, just to make sure that you've been hydrated and everything too. We'll check your kidneys, check your electrolytes. Assuming that everything comes back okay, we'll also check for influenza, COVID, RSV. They're always still pretty elevated in our area, so we'll just go ahead and make sure that that looks okay. And we'll swab your throat while we're at it as well, just to make sure that you don't have any strep with working in a children's hospital. Chest x-ray. As far as home going, I will send you with a prescription to treat for the sinus infection, which is, I believe, all that you have, and then just a little bit maybe going down here, but we'll make sure that there's not an extra pneumonia that I have to treat, but we'll treat you with the Azithromax pack, the Z-Pack. I'm sure you've taken that before. To make sure you're taking that with food. Drink lots of water. I'll give you some steroids, an inhaler, if you use one of those.
Yeah.
Okay. And then if you need over-the-counter medications to treat anything else, you could take Sudafed, which you'll get over-the-counter from the pharmacist, to help dry everything up. It's a decongestant. You could do some Flonase, Afrin. You could also do, it's another nasal spray. If you are going to use that, you can only use it for 3 days. Otherwise, your body's going to think that you chronically need it. Tylenol, ibuprofen for pain or fever. Okay. Reasons that I want you to be seen again: if your breathing is worsening, you feel like you can't catch your breath, like you're in distress, probably best to call 911 or go to the ER. If you feel like you aren't keeping anything down, you're dehydrated, you feel like you have a fast heart rate, then again, fast heart rate, probably go to the ER, but otherwise you can call our office and I'll see you back. Otherwise, hopefully we give you the right treatment and you feel better here in the next few days. Any questions about anything today?
Nope.
No questions? Okay. Hope you feel better.
Thank you.